sitting with Tsulu, our mental health training officer, and we will be discussing depression and burnout amongst healthcare workers. Hello, Tsulu.
Hi, Dumi. Thank you so much for the privilege.
You are most welcome. So I have a few questions for you today. The first one being, what is burnout and depression?
Burnout and depression has overlapping symptoms, but they are different. With burnout, it's mostly the person will be fatigued, and it's mostly characterized by work stress. And with depression, it has three stages: mild, moderate, and severe. The mild depression, it can be treated with counseling, and moderate and severe, the person will have the following symptoms, which is low mood for more than 2 weeks. The symptoms persist for more than 2 weeks, and insomnia, loss of appetite, loss of concentration, suicidal ideation, and the person can also be a self-cutter.
Okay. And what are the causes of depression amongst healthcare workers?
The causes of depression among healthcare workers, it's workload, lack of staff, lack of support from the supervisors or managers, and even the job that they're doing. Like during COVID, the way people were dying, it also affected them. It made them to have burnout, and some of them were even diagnosed with depression. Seeing people dying is not it's not an easy thing.
True.
So it
And
affects them mentally.
mm, and what are the causes of burnout amongst healthcare workers?
The causes of burnout are basically more or less the same as the ones that I've given you for depression. It will also be workload, financial situations, loss of poor and not getting support from their managers, lack of resources. Yeah, the environmental factors also, they contribute.
And in your opinion, how can healthcare workers manage depression?
Through counseling,
Mm,
briefing, and they've got these EAP programs within their facilities. But most of the healthcare workers, they don't like making use of the EAP programs. So I would advise that as soon as one realizes that they're having symptoms, it's better to consult early than late so that they can be treated earlier. Because with depression, if it's in a moderate or severe phase, the person has to be admitted at times or see a specialist, psychiatrist or psychologist. And they also have to put on medication, antidepressants, to control their mood, to stabilize the mood.
okay. And what is your advice to healthcare workers on how to manage, or rather to take better care of themselves and their mental health?
And also, to me, before you ask me that question,
Mm-hmm.
with psychotherapy, it depends on an individual. Some
Mm,
people prefer individual psychotherapy, while others prefer group therapy. So I think it depends on a person which kind of a therapy will work for them.
mm,
Yeah.
okay, all right. And, you know, based on all of that you have mentioned, what is your advice to healthcare workers on how best to take care of themselves and their mental health?
I think it's best for to prevent burnout and depression. It's for them to talk among themselves about mental health and awareness and things that are affecting them within the workplace. They should be addressed, even if they're not dealt with, but they should talking. I think it would relieve the stress levels.
Mm,
And also to seek help before it's too late.
Thank you for your inputs, Tolo.
Thank you, Tumi.
To find out more about mental health, please visit our website www.massiviwe.org.za. Thank you.
Thank you. Bye.